the rise of the cities and the advancements and how everything changed from there.
From 1800 to 1900, the population in Europe nearly doubled due to medical advances. And quit moving it. Improvements in public sanitation also slowed death rates.
Robert Koch identified bacterium. It claimed over 30 million lives. By 1914, yellow fever and malaria was traced to the animals and equipment. He insisted that people bathe more, change their clothes more, and to have a better hygiene.
Hospitals were dangerous places. Wealthy and middle-class patients preferred to be treated inside their homes. Poor, lower-class patients usually had a death sentence for diseases they would catch. Florence Nightingale was a nurse during the Crimean War who had insisted on better hygiene in field hospitals. She had also founded the first school of nursing. Joseph Lister had discovered antiseptics, how they prevented infections, and he put surgeons to sterilize instruments and wash hands before an operation.
Urban renewal was the rebuilding of poor areas of cities, which took place in Paris in the 1850s when George Haussmann destroyed many streets full of tenement housing in place for boulevards and public buildings, making putting up barriers for rebels easier and for troops to reach any city of the day.
Paved streets made urban areas more livable. Gas lamps, electric street lights. Police forces were organized and expanded fire protection, increased safety. New sewer systems also made cities more healthier places to live. By the 1900s, architects were using steel to construct soaring buildings known as skyscrapers.
Some working class families could afford better clothing, newspapers, and even tickets to a music hall, yet went home to small tenements and overcrowded neighborhoods. Whole families sometimes cramped into a single room and undergo or illness meant lost wages that could rule a family, but cities attracted millions. New residents were drowned as much by excitement as by promise of work.
Workers had protested against low wages, long hours, unsafe conditions, and had a constant threat of unemployment. Workers had formed mutual aid societies, which were self-help groups to aid sick or injured workers. They had also formed labor unions. The main tactic of labor unions were a strike.
Pressured by their unions, government passed laws, regulations, working conditions. Laws outlawed employers to hire children under 10, later outlawed child labor laws altogether.
They also banned employment of women in mines. After other laws limited work hours and improved safety. Wages also varied. Unskilled workers received less than skilled workers, and women received less than half of the pay during some work.
As standard of living rose, families ate more varied diets, lived in better homes,
Advances
and
in
dressed
medicine
on
improved health and dropped death rate
mass-produced clothing.
dramatically.
Some workers had moved to suburbs, traveling to work on subways and trolleys.